episode of the Nourished Soul podcast, I interview Dr. Britney Turk. Dr. Turk is the founder of Mountain View Counseling. She's a licensed professional counselor in Georgia, but also does lots of training. And she is certified in HeartMath biofeedback. And she's also done extensive training at the brain on all kinds of neurofeedback and biofeedback and brain-based techniques. And so I wanted to have her onto the show specifically to talk about HeartMath because I love using HeartMath techniques. I've been a fan of the HeartMath Institute for a long time now. And I also took one of Dr. Turk's trainings a couple of years ago and thought that she did a really excellent job of explaining what is HeartMath, how to use it. So in this episode, we talk about that, but she also talks about some of the things that nourish her soul and some of the work that she's doing now. And I hope that you enjoy listening to Dr. Turk as much as I enjoyed talking with her.
So hello, Dr. Turk.
Hey.
It's so good to see you.
It's so good to see you, Kelly. So good.
I'm so grateful that you are willing to take some time to talk to me about HeartMath. When I took your workshop, it's probably been, I don't know, couple years ago, probably. And I just thought you did such an amazing job in that presentation. And it was so helpful. The way that you explain HeartMath, you know, I've been a big fan of the HeartMath Institute for a while, but I thought you did a really beautiful job of putting all that together. So,
but now was that, were you in the 1 hour training or the 3 hour?
I feel like I think it was the 3 hour training.
Oh, okay.
I don't know. It might have been a 1 hour.
I just started doing the 3 hour, I think last year. I did it at the LPCA conference. I do have a neuroscience training I'm trying to get approved. But yeah, I have a 1 hour that I'm doing. It's kind of like that general overview. And then the 3 hours more specific to HeartMath skills. And I always tell my attendees, look, this doesn't certify you to do it. But you know, you're getting a little bit more knowledge and you can decide, you know, hey, is this something that you want to include, you know, in your practice? And I recently developed a neuroscience training just because I think we need to have a little bit more, particularly among professional counselors, we need to have a little bit more background on neuroscience. Clients, I find,
I agree.
They really hunger for that information.
Yes, yeah, for sure. And I really got interested in HeartMath personally. So I was, you know, and I ordered the little thing to see my congruence, and I think that's always a little bit hard. So it might be helpful for people listening to this just to know what is HeartMath.
Sure.
And how do you explain that?
Sure. So I think it's important to separate HeartMath from biofeedback. Biofeedback is an overall treatment approach that looks at just getting your body kind of in tune. Because when our body is in tune, our mind, our psychology is in tune. And there are various modalities from which you can do biofeedback. HeartMath is a vendor. It is a company that has a program that focuses on heart rate variability biofeedback, which is again, specific modality. So it looks at the beat to beat changes in your heart rate, which is different than heart rate per se. We're looking more at the changes in the heart rate because that indicates how well your nervous system and your brain are functioning. Your vagus nerve, which regulates a lot of our emotional and psychological processes. That is really what we're looking at when we do HeartMath. So they have a different series of technology. They have handheld devices. They have programs for a laptop, which is what I use in my clinical practice. Various sensors that you can get, and they will certify you and train you in various types of training. You know, if you're a health professional, maybe let's just say you're not a health professional, you're like a life coach, but you think it's really cool. Like they have a training for that, for you to be a coach, for you to be a mentor. With HeartMath, I have a clinical license, so I have a clinical certification. And they recently changed the rules where you don't have to re-up it; they just automatically renew. So you're not having to go out and get more and more CEs when the information really is about the same. And then I also have
Mhm.
certification as a trainer. So I can go to conferences or go to organizations and train people on HeartMath. So that's a little in a nutshell.
Right. Mhm. Mhm. Yeah. And I think what I started getting interested in it, I watched a documentary called Power of the Heart,
Yes.
and it was all about the energetic, and HeartMath was in that institute, was highlighted in there.
Mm-hmm.
And I just thought the research that they're doing at the institute was fascinating to me.
Mm-hmm.
And the fact that our heart is, what is it, like 5,000 times energetically more stronger, that vibration that you can read is
Mm-hmm.
stronger than our brain.
Mm-hmm.
And that was something that struck me, is that I think the brain's really important, but I
Right.
think in our field in counseling, often people forget about the heart and how
Right.
powerful the heart is.
A lot
Yeah.
of it, I think, is the connection. I call it the heart brain connection. That's the term HeartMath uses.
Right.
And
Right.
one thing I'll share a
Right.
lot with clients is you actually have neurons in your heart.
Mm.
There are actually
Right.
microscopic images that show you have neurons in your heart, and your heart sends twice as many messages to your brain as your brain sends to it. So the conventional, what we're taught in high school biology of your brain is the master control center. Well, that's not 100% accurate. It's really the heart and the brain in tandem together. And what happens, with clients that I see, clients that probably other counselors or mental health professionals have seen, is that gets out of sync. That heart and that brain,
Right.
they're not working as efficiently, as bioenergetically, as they should.
Mhm.
And I do think, in counseling and in psychology, we're kind of on the cusp of this like next wave of bioenergetics work. So like not only do I do heart math and biofeedback, I've recently gotten into doing somatic art therapy, which has been very helpful because
Uh-huh.
because a lot of times we don't have those thoughts. We don't know exactly why we're experiencing that anxiety or that trauma, but when we can tune into the body and it just kind of comes out. And so this
Oh, I love
bioenergetics
that.
work, I think, is like our next wave as far as like interventions that we're going to be heading to. So uh, it's great. It's great to get familiar
Okay.
with it.
Yeah, so what do you feel like you use the most out of all of these different
Um,
modalities?
well, it depends on the client. I
Right.
have some clients that are not necessarily like when their first couple sessions, they're maybe not as comfortable using the biofeedback because it is very technology and science based. So of course it depends on the client. Um,
Mhm.
Usually kind of my standard is I say, hey, I would like us to try this. Let's at least do the assessment piece just to see we're just popping the hood. If you think about a car, you can't always tell what's wrong with your car just looking at it. You got to look at the
Mhm.
engine, the oil filter, all those things. So usually I try to have them at least do the assessments so we can see like, hey,
Mhm.
is there anything going on with the nervous system, which 9 times out of 10 there usually is. Um,
Right.
and a lot of times
Mhm.
when we start doing the techniques, they tune up very fast. I've had some people, it's almost like they're natural at it, whereas with other
Mhm.
people they might struggle a little bit more. So that kind of depends. Recently, I've gotten into a lot of somatic art therapy. I had a colleague actually recommend it to me because I've had a lot of trauma clients lately, and that has been very helpful. So I've just kind of started doing that and kind of getting my feet wet with that a little bit. But I've been doing the heart math for a pretty long time. I
Yeah.
originally got into
Mhm.
heart math when I was in my master's program. It was what my master's
Mhm.
degree thesis was on, was on heart math. And
Mhm.
then when I graduated, I think it was maybe my first year as an associate, I got my clinical certification,
Mhm.
um, which was a little pricey, but I had some help to pay for that. And then I don't really think I really took off doing the heart math until I left my first place of employment, which was a pediatric practice. And I moved to a practice that was more, it's called the Brain Science Center. It was a neurofeedback
Mhm.
practice, and I had a little bit more freedom to do that more. And so that's really, I
Mhm.
think, probably a couple years ago
Mhm.
when I really made that a focus. My practice currently at Mountain View Counseling, it is actually a service line. on our website. So we provide biofeedback, we provide counseling, and we provide telemental health, of course, with COVID. That's been a real big push for that as well.
Right.
So I actually personally market it as it's its own separate service line. I have had some clients that say, I just want biofeedback only. I don't want talk therapy. Maybe they've done that and didn't really have a great experience with that. It's great with adolescent boys who maybe they don't really want to talk about their feelings. They love HeartMath because it's like a game. It has games on it. You can play the games. It's fun. So there's different ways I feel like you can approach it with clients. I mean, I always go to, what are your goals? If your goal is, I want to get my anxiety under control, or I have trauma and I can't regulate myself. I've even used with borderline personality patients that, they have a lot of dysregulation. So pretty much for anything that's emotional dysregulation based, that's nervous system based, I'm going to recommend HeartMath. It kind of plays out in different ways depending on the client. But it's usually my go-to.
Yeah. And this getting this congruence or some of these exercises, are there different things that people can do when they're not in your office? So without the computer-based games and things?
Sure. So as far as congruence, or HeartMath calls it coherence.
Coherence. That's what I'm trying to say.
You don't necessarily have to have the technology. And this is one thing I really emphasize to people. They hear biofeedback and they think they have to pay for this really expensive technology. You don't have to. What really matters is the emotional regulation techniques that are heart focused that I teach. Like, that practice is more important. Now, that being said, I do have some clients that they have bought there's an app and there's a sensor you can buy. It hooks up to your phone. It's really easy. You can do it on your phone. I have some clients that buy it, but I've had some parents that have bought it for their teens or their child that I'm seeing. With kids, there's actually a board game that I have in my office that you can play with younger kids. So some people kind of on their own will go buy the technology. Of course, that helps because that's giving you the real-time feedback, but it's not 100% necessary. I also have a couple devices that sometimes I'll rent out. Like, if I really feel like the client needs that extra layer of support, they can pay a real inexpensive rental fee, and they just bring it back when they're done using it. But you don't have to have the technology at home. Usually kind of what I recommend for clients is, okay, I'm going to teach you this technique, and maybe it's one or two techniques that I teach in a session. There's about 4 or 5 base techniques that I focus on. And I'll say, okay, I want you to practice this every day, because it needs to be a daily practice, to start once in the morning and once at night, because that gets you kind of in a habit. When you have that amygdala hijack going on in the brain where it's kind of taking control of your frontal lobe, it's really hard to remember to do a technique because you're just in the moment, right? So I want them to get in the habit of it. And then, after they kind of get comfortable with it, they feel like it's a little bit of a habit, usually about a week or two, I'll say, okay, now let's start applying this to when you're experiencing your symptoms. So let's talk about your triggers. Let's talk about when you have those panic attacks or when you're having those trauma reactions. And now let's apply it to those situations. And it's easier for it to like transfer over. So that's kind of my homework, I guess, process for when they're outside of the session. And I work with them too on, I've had some clients say, oh, it was just really hard for me to do them this week. And so maybe that's when you get into a little bit of motivational interviewing and talk about, okay, what are the challenges that you experience with this technique? Usually it's, I just forgot. So a lot of times what I will talk about is, okay, like, let's come up with a reminder system. Most of us we're all on our phone, right? So let's, put some reminders in our phone and remind you to, and just kind of get into these habits and these grooves. And I think that is really, really helpful.
Yeah, for sure. Yes, it's the little monitor with the app that I bought. And I do like that. And I did use that with some of my teens, really like that. And their parents would get that. But I'm not, I just use it personally, mostly.
Right.
So I thought it was really helpful to
Well,
just to
right.
see that in real time.
And I think one thing too that's really important with the HeartMath, and this is one thing that I talk about in my 3-hour training. The 3-hour training is really focused in two ways. One, practitioner self-care, but also like these are some things that you
Right.
could maybe work with your clients on. You can't say you're biofeedback certified, HeartMath certified. You know, you got to do a separate training for that.
Right.
But I think it's important for the
Right.
practitioner to do them as well. I think especially in this time of I don't
Yeah.
know if we can say post-COVID or not, but
Sure.
I don't know about you, but I'm seeing a lot of trauma clients. I get a lot of trauma that walks through my door, and it's heavy. And you have to have some self-care. You have to take care of yourself. And the HeartMath techniques are a really way of doing that. Of, you know, let's say you have a really intense session and you're back to back. You don't have breaks. Well, okay, maybe take a 5 to 10 minute HeartMath break, and just to kind of like recenter yourself in your heart and get that heart brain connection really activating. So it is really good for practitioner self-care as well.
For sure. Yeah. Can you share one of the techniques that you would
Sure.
recommend people try?
Sure. So, one of my favorite techniques is actually not one of the first few that HeartMath teaches, but it's called attitude breathing. I really like attitude breathing, and they have a little chart where it's different negative attitudes you have, and what would be a replacement for it. I'll just share one. It's a really long chart. But let's say you're feeling anxious. Okay, most people I think know what
Yes.
anxiety feels, right? So, kind of the first step is you're doing some heart focused breathing. You're breathing a little bit slower, deeper than usual, focusing on your heart or your chest area. If you're not familiar with doing heart focused breathing, sometimes it helps to just kind of visualize a heart in your mind. It could look anatomical, it can look like a Valentine's Day heart, whatever. The metaphor doesn't really matter. But just imagine that is beating, and your breath is kind of timed to that beating. That's kind of a helpful visual if you're not super familiar with that. So you start off with your heart focused breathing. And then as you're doing your breathing, you want to breathe in calm. And I add on top of this and breathe out that negative emotion, that anxiety that you're feeling. So you're breathing in calm and you're breathing out the anxiety. That is one of my favorite techniques. I use that one quite a bit. There are several different tools that you can use, and everyone that I've worked with, they have a favorite. And
Right.
I have some people that really like the neutral tool, and some people that they hate it because it's really vague. It's not as concrete as like attitude breathing per se. So attitude breathing is for my people that need more of a more tangible or kind of concrete technique. And so there are a variety of different techniques, and you kind of find the one that really just works well for you. I call it, you got this toolbox, and we're putting all kinds of things in this toolkit. And you know what? You might have attitude breathing works really great when you're at work, but not at home. So you might have to pull out a different technique. So I like to teach all of the techniques, and then the client can decide, okay, this is the one that really works well for me. I would say probably the two most popular ones are quick coherence and attitude breathing. I think those are probably the two that people use the most.
Right. And quick coherence.
So,
I can't remember exactly what that was.
Yeah. So quick coherence. First step is heart focused breathing. You're gonna do heart focused breathing with every technique.
Right.
That's
Which I love.
cool.
I mean, that alone.
Yeah, and
would help people.
that is actually a technique in and of itself. HeartMath, when they recently did a curriculum change, and they have actually made that one a separate technique. They actually kind of repackaged neutral, which I like it the old way, but that might just because how I was trained.
Yeah.
They've kind of repackaged it into inner ease, but the heart focused breathing you're going to do with every technique. That's one of the two base principles. The second base principle of HeartMath is trying to re-experience a positive emotion. So quick coherence is heart focused breathing, re-experience a positive emotion like appreciation or caring. And there's a little of a trick with quick coherence. What a lot of people will do is they will think of a time when they felt appreciation, caring, which is okay. It gets you kind of halfway there.
Right.
It's really about feeling it again. And I think for a lot of people, we live in such a thought-driven world. Cognitive
Yes.
behavior therapy. That's a very
Cognitive. Oh, yeah.
very popular therapy. I love CBT. It's great, but it doesn't work for everybody.
Sure.
And we are not, I don't think, culturally in a place of experience your emotions, and it's okay to experience those emotions. And that's another thing that I kind of like layer on with this is, it's okay to feel what you feel. Like that,
Right.
that is okay. And it's okay for other people to feel what they feel. And so the quick coherence also kind of leads to a nice discussion of like feeling acceptance of it's okay to express it, and like self-gratitude, and it's okay to be kind to yourself when you feel like a negative, like anger. That's a really great example. A lot of people will feel bad when they feel anger, and they will come to me for anger management and will say, I don't want to feel angry ever again. And that's a whole session where we're talking about knowing what anger feels like is a good thing, because one, it tells you information, and it's not really about the anger, it's about how you express it. So we often, in the psychology circles, use that term of anger management. I hate that word. I wish we would reframe it in aggression management, because that's what really the problem is. The problem is when you're aggressive, not when you're mad. Right. So, HeartMath leads to some great, I think, conversations about, like, I use feeling wheels a lot, talking about emotions. Are there emotions that you're just uncomfortable with? And appreciation and gratitude. We, I think, as a culture, especially in the US, we're very ungrateful. We're very, very, very not appreciative. I even have had some clients that they tell me, like, I don't know what happiness feels like. They don't even know what the sensation feels like. I don't know what appreciation feels like. And because I've encountered that so much, HeartMath has a technique called appreciation lists, where you make a list of things you're appreciative for. And these don't have to be like big monumental things. It could be, well, I got out of bed this morning and brushed my teeth, right? Okay, well, at least you got up and did something, for someone who's experiencing very severe depression, that probably is a big victory.
Yes.
So I talk a lot about, you got to celebrate your victories, even if they're small. And the appreciation list kind of help build that quick coherence technique, to where they can access some kind of powerful things. So those are kind of probably the two: attitude breathing and quick coherence. I think those are probably the two main ones that I think work the best for people. Of course, there are outliers. They might like neutral tool or inner ease, or heart lock-in, a little bit better. But those are probably the two main ones that I've seen the most success with.
Heart lock-in sounds great. That sounds like a
heart lock-in is a really good one. They teach you this one a lot when you do the trainer certification. The trainer certification is 3 days long, and they have you do a heart lock-in every day, before you start, and then when you end. They're really long. They're really long days. So you do need that heart lock-in.
Yeah, I bet.
Heart lock-in is essentially quick coherence plus an extra step. So you're doing heart-focused breathing, you're re-experiencing positive emotion, and then you're trying to radiate that out to not only to yourself, but to others around you. And so really the principle or the research, I should say, that really started the heart lock-in technique was they were looking at electromagnetic fields. So we all have electromagnetic fields. We emit one from our brain, but it only goes about, a foot from your brain. Your heart goes out about 3 feet. Now, we think it's actually a lot bigger than that, but our technology to measure EM fields only measures to a radius of 3 feet. So we think it's a lot bigger than that. So I like to use the example of, if you've been about to go like in a room and you just get a bad feeling, like, I don't know if I want to go in here. Like, and it's like goosebumps, right? Okay, what's happening there is your EM field is brushing up against someone else's. And in our EM fields, basically our emotions get translated as energy. And that person is radiating some energy, some emotional energy that's kind of brushing up against yours. And so they developed this heart lock-in technique to say, okay, if we know EM fields can do that, it kind of stands to reason that maybe we can change other people's EM fields, where if they're having a negative field, we can make it positive. And so that was
push
really
some
where
positive in there.
Yes, we can push them into a positive, mindset. And very much in the trainer program that I did, and it was virtual, it was over
Mhm.
Zoom. So, you're not in person
Mhm.
really with anyone, but a
Mhm.
lot of people,
Mhm.
including myself, like you really noticed a
A
difference,
shift.
um, in the
Mhm.
group dynamics and in the environment. Um, so
Mhm.
HeartLock and I use a lot for if I'm doing organizational trainings. So like let's say if I'm going
Right.
to go to a hospital. So hospitals are really overtaxed right
Mhm.
now. I know a lot of nursing
Yes.
departments that are just ready to quit because of all the trauma
Right.
from COVID.
Yeah.
And I will go in there and I will teach them some of these heart math techniques, specifically heart lock-in. And I have had people tell me, you have no
Mhm.
idea how much this has changed the dynamics of our department. Um, in fact,
I'm sure.
my husband's workplace, his boss has actually asked me if I would come in and like do some organizational stuff with them, just because when you are working in, organization with a lot of people, or very corporate
Mhm.
culture, you do have these
Right.
different group dynamics that come about. And what we
Mhm.
know with the heart math is that it does help improve your group dynamics. It's not only an individual practice, but it can affect people on a organizational level and even on a global level.
Absolutely. Yeah. I think that's what's so fascinating to me
Mhm.
and looking at the research. So if people are looking for somebody to help them,
Mhm.
I'm guessing most people have heart math on their websites, but I think you could go to the institute maybe and
Yeah, they have a
find people that
directory.
way. How would they
They
find?
have a directory. They do have a directory. I don't
Sure.
really know how much people really use it or keep it up to date. So
Use
like
that.
I'm
Right.
on there, but I don't really keep it that up to date because I have enough websites to track.
Yeah.
So I think for the most part,
Mhm.
most people advertise it on
Mhm.
their website. One question I
Sure.
get a lot is like, well, how do I get, trained in this? Well, if you want to be heart math trained,
Right.
I think it's best to go to the Heart Math Institute. And they have two different websites. They have heartmath.org and heartmath.com. One is a consumer site and the other is more for professionals. I don't remember which one it is. I always get them confused. Um, and they have lots of
Mhm.
trainings that you can pursue. If you're interested in clinical, they have a clinical training. They have two different clinical
Mhm.
trainings. There's one that's like for anxiety and
Mhm.
depression. They have a trauma training and then they have the clinical interventions. I got trained in clinical interventions because it's a wider scope.
Right.
So you can apply it to a lot more
Mhm.
issues. They have a trainer program, which is more if you want to do like continuing ed, type events, if you want to go into organizations and train people.
Right.
And then they have a mentor program, which is not really for health
Right.
professionals as much. It's more like if you're probably
Mhm.
like a life coach per se. So I have a friend who's
Mhm.
a life
Mhm.
coach, and we talk a lot about heart math, and he does a lot of business type coaching. So
Mhm.
that's kind of like if you want to get heart math trained. Now, of course, there are other modalities to biofeedback. Um, BCIA, which is
Sure.
the International Biofeedback Center, they do have some trainings you can get.
Mhm.
It's a little bit more intense. I
Mhm.
personally think it's easier to go through a vendor. If your vendor is offering training, do the vendor training. It's less expensive, it's
Mhm.
less work. Um, like with BCIA, there's like a test you have to take,
Mhm.
and you have to do like a lot of supervision and stuff.
Yeah.
Where heart math,
Right.
you do the training and you write a case study and you're good to go. And it's very thorough. Like
Mhm.
you get into a lot of you do a
Mhm.
lot of like spectrum analysis, which clinically I don't really do. But to do the training, you have to understand,
Mhm.
how spectrum analysis works with the heart and the brain. So from a research perspective, it's
Mhm.
very, very interesting. I just don't think it has a lot of clinical probably application. Um, but yeah, those are
Right.
probably the
Mhm.
two training methods. I also tell people be consumers of books and research. So I've
Yeah.
had students reach out to me and say, "Hey, I'm really interested in biofeedback. Can you recommend some books?" And I have a book list, and like I have a whole shelf at home that's just
Mhm.
biofeedback books. And I say you need to consume it
Mhm.
because it took me probably I was in my master's program when I was learning. It probably took me about 2 to 3 years to really completely understand the process because it's such
Mhm.
rich information, and a lot of it's not really psychology literature, it's medical literature. And you kind of have to
Right.
understand that
Yeah.
that
Mhm.
medical side a little bit, you got to understand the nervous
Mm-hmm.
system and the vagus nerve and how
Mm-hmm.
that connects with the brain, like all the
Mm-hmm.
cranial nerves, like vagal tone, the different parts of the
Mm-hmm.
vagus nerve, our dorsal, ventral. Like there's a lot of biology that you really have to understand.
Mm-hmm.
Now, HeartMath has a really great book that they came out, I think, a couple years ago that actually goes
Mm.
through the biology part, and it's pretty easy to read through. It's really, I think they tried to write it more for a consumer. So I have book lists that I'll recommend to folks. I'll say, hey, if you can find someone to mentor under, so I do offer mentorships. If you're interested in biofeedback, you can mentor under me. Like you need to find someone who knows it. When I was an associate, I worked for a neurofeedback guy, and I learned a lot
Mm-hmm.
from him. Now he didn't do HeartMath, but he did
Yeah.
he did neurofeedback.
Your website, do you have a list of resources on your website?
I don't think I have.
Make
I
sure
don't think I don't think I have it on my website, but I can provide it to you.
Okay.
Um,
That's
it's at
okay.
my
I just was
home office.
thinking when, yeah, I was just thinking when people are trying to, I'll make sure that we include your email, your website, so people can get in touch with you and figure that out. But I
Yeah,
think it's
yeah.
really helpful to understand that a lot of trauma, well, even just anxiety, I work with a lot of folks with anxiety, and I'm focusing on the gut healing part now, right?
Right,
With the
right,
vagus nerve, all
right.
about that too. And then, but people that have been doing a lot of talk therapy and felt like that was only minimally helpful, which you
Mm-hmm.
and I have been doing for
Right,
a long time and can understand that. They're, doing some body work and having these techniques that you
right.
practice daily so that
Mm-hmm.
you're ready. Your body and your nervous system, in my experience, your nervous system responds much more quickly
Right.
once you've, it's sort of exponentially greater the more you practice.
Right. And
Yeah.
my approach, is kind of a combination of things. I do the
Mm-hmm.
biofeedback. I recently got a mental health integrative
Right.
medicine specialty, which is, what type of foods are you eating? What kind of exercise
Yeah.
are you doing? So for example, if someone's coming in real anxious and they have 5 cups of coffee a day, like, okay, maybe you need to cut back on
Right.
that, like a little bit. And so
Right.
sometimes we talk about food and healthy foods, especially with, let's
Mm-hmm.
say, kids with ADHD. Okay, what they eat has a
Right.
lot to do with that
Mm-hmm.
psychiatric disorder. So, are you eating
Sure.
green vegetables? Are you removing red dyes? Things of that nature. But then on top of that, I also
Yeah.
add the talk therapy too. If they are comfortable with that. Not every client that I feel like walks through the door necessarily is. A lot of the clients that I see,
Right.
they maybe have gone through 2 or 3 therapists, so they're a little jaded, probably about the process, or a little disillusioned. And so the biofeedback, that is very refreshing to them, because it's like, oh, this is new, and it feels more like medicine
Right.
rather than,
Yeah.
or a medical intervention, I think, rather more than, oh, let me just talk about, whatever's going on with me today, which I do think there's benefit to that.
Right.
Like I do think you need to have
Sure.
people to process stuff with, who's kind of this third party,
Absolutely.
right?
Right.
But I think you need to have more of this integrative, approach. In some psychological circles, they don't really like it when you say, oh, you're an eclectic therapist. Um,
Right.
I think it's a great thing, because not everybody fits the same cookie cutter mold. I know lots of
Right.
therapists that say, "Oh, I'm a CBT therapist only." Well, that doesn't work for everyone.
Mm.
So I have a
Right.
lot of clients that will say, what's your modality, or what's your theoretical orientation, and I'll say,
Mm-hmm.
well, I use lots of different theories. Um,
Right.
I think maybe my least liked one is psychoanalysis, but I have used it on occasion, just because, when you're
Mm-hmm.
talking about parts and internal family systems, like sometimes you have to kind of get that deep. But I think you do have to have a little bit of an integrative approach. And I think the medicine part, whether you're doing, food, diet, gut work, that embodied brain,
Yeah.
or you're doing, HeartMath, or some type of biofeedback, like I think that is an important part, because people reach their outcomes a lot faster with biofeedback.
Right. I think, right. Absolutely. Yeah. And I think, to feel better, you can feel better so much more quickly.
Right.
When you're working with it, and I've come to realize it's all energy. So when we're using tools that work with our energy, it's just very efficient.
Well, and I think here's the other thing too. It's very tempting to just want to go to a psychiatrist and get some meds, right?
Get some meds.
And I feel better temporarily, but then over time, that medicine starts to lose its effectiveness. And I've had people ask me, well, why does that happen? I say, because you're just covering up the symptoms. The problem is still there. So the way I kind of frame it is therapy, whether you're doing biofeedback, talk therapy, whatever your modality is, that gets rid of the problem, or at least it's going to help you get rid of the problem. But whereas medicine really just covers up the problem, which I think there is a time and a place for medicine. I've had some clients where I've said, you need to be on meds because you're not at a baseline level where I think even therapy could be effective. Because let's say your anxiety is just so high, or let's say it's someone who's having lots of hallucinations. Lately I've had several clients where the auditory hallucinations are just so powerful they can't even focus on what I'm saying, because they're hearing someone scream. Right. So sometimes you do have to have medicine just to get you to a baseline level of, okay, I can do therapy
now, I can work up. Right.
And we know the research says, medicine plus therapy is more effective than either alone. But, I think a lot of people's gut reaction is, oh, well, let me just go to the doctor and medicate this. Well, eventually it reaches a point where that just doesn't work. And you have to start looking at, some other options. And it's not going to be probably fast. And it might not necessarily be cost efficient either. And I think as therapists, that's another part where we need to advocate and say, look, this isn't the easy button, but this is going to help you reach your goals and get relief. But you do have to invest in it. Biofeedback is an investment. Gut work, that's an investment. Talk therapy, that's an investment. And I think that's a kind of a hard pill to swallow sometimes. Because why can't I just have a med fix the problem? And so I think that's a conversation that I've had with a lot of my clients, of those kinds of issues.
Yes. Right. Yeah. And I think some people have to go that route and see that only gets you so far, and and all the side effects and all of that. And and then sometimes you just have to see.
Right.
And then you realize that you're still stuck with the same core kind of problems. So well, I am grateful for your time. I think it's been super wonderful to talk to you again and to help learn more about. I learned a couple things too about HeartMath, and I'm gonna go check some things out. And I think it's really for people to even just know that it's a tool that's out there that's very powerful. Can really help people get the relief. That's all about the relief. So, and then I'm guessing you do your own self-care.
Of course.
And using that. Is there anything else that you feel like really nourishes you, since this is the Nourish Soul podcast?
So self-care is kind of a process for me, and it really depends on like how bad of a day I've had. So I remember I had one session that was just really, it was with a child client, and it was very, very bad. I think it was probably the worst session with a child I've ever had. And not because of me, it was just, she was very intense. And I had gone home and I told my husband, I said, okay, like I'm taking a bubble bath and leave me alone. And I don't really do that because I'm not like a bath person. But that was something that I really needed that day. Normally kind of my self-care routine looks more like I love to write. I love to quilt. I love to read. So typically I'm engaging in, those kinds of hobbies and activities. Usually when I'm at work, I'm doing HeartMath, techniques. Maybe not every session, but just kind of like when I feel like I need it. I usually try to do it like once or twice a day. Really to just kind of stick with that daily practice. of course, my relationships are also very important to me. So my spouse and I, we will go and, go on dates. And I think that, the date your spouse, hashtag that's all over Facebook. I think that that's really, really important. So I use a variety of different strategies, just kind of
Yeah.
depending upon, how I'm kind of feeling that day. So that's why I think the body work stuff is really important, because you have to be able to kind of tune into what sensations am I feeling, where am I feeling them,
Right.
and what do I kind of need? A really common question I'll ask clients
Right.
is, what do you feel like? Because sometimes it's just like there's just so much you don't know where to start. And I'll say, what do you feel like you need from today's session
Right.
to help you? Like, what kind of relief do you think you need?
Yeah.
And sometimes I'll even ask that myself, like, what
Right.
do I need right now in this moment? And so that's a lot of how I will kind of guide
Exactly.
my own self care.
Yeah. And I think that the more practice, whatever practice you have, whether it's HeartMath or relaxation response or some of these other things that can help with getting in tune with your body, what sensations do you have, and being okay with them, this acceptance piece.
Mm-hmm.
Because people often don't know what they need, and you have to tap in and be able to name some of what's happening for you to figure out what you do need. And I think it's important for people to realize that self-care gets thrown around a lot, especially self-care of therapists, but it can be super, super simple things, and it can be something that changes because today has been rough. What do I need today?
Right. They don't have to be really these complex, complicated things. I mean, a lot of my self-care, honestly, is they're just hobbies that I just like to do when I have time. And I think another key part with self-care too is time management. Usually when my
Maybe
work
some
day,
boundaries.
I end at 7 o'clock, and when I go home, I try to not do anything work related if possible. Now that's not always the case. I also teach, so maybe I have to put a post up on a discussion board, or answer a few emails. But I really try to just disconnect from that. So I do think disconnection from technology or whatever it is that is your time suck. You do have to kind of disconnect from that some. But yeah, they don't have to be hard things. I actually have a self-care wheel that's based on the domestic violence wheel that I share a lot with clients, and it divides self-care into different areas. And we talk about, okay, what are some areas of self-care that you do that are helpful, and what are some that maybe are being kind of neglected? And usually there's about 3 or 4, areas. Maybe they're really good at, hobbies, or their spiritual, self-care. And maybe we need to focus on things that are more work related, like having boundaries, like turning off your email for like the weekend, taking a vacation, having being assertive, with your boss. Those are things too. Like, I really think therapy really just all boils down to self-care. And even on my little wheel, it says therapy is self-care. It's actually written on there that, hey, you're doing self-care time right now. So I think that is really helpful, just to kind of engage in those practices.
I 100% agree. I think, So I think this gives people lots of information and some things that they can dig into. So
Sure.
Thank you so much for your
thank
time.
you for having me. I was glad to be able to see you again, but also to be on your show. I really appreciate that. And if your viewers need any resources, I'm more than happy to provide that, and just help wherever I can.
That's wonderful. Thank you so much. Hope you have a wonderful weekend.
Thank you. You too.